Welcome to this explainer. Today, we're diving straight into the absolute boom happening right now in the medical device industry. We're going to look closely at the explosive growth this sector is experiencing, but more importantly, we're unpacking the core conflict at the heart of it all. It's this paradox of massive growth versus massive risk. Because, when an industry scales up this incredibly fast to meet global health demands, the stakes for safety, ethics, and the environment just completely skyrocket.
Let's actually kick things off with a direct quote from the SASB standards for medical equipment and supplies. It hits the nail on the head. The global health challenges we hear about constantly, they are actually acting as massive growth engines for medical tech. We aren't just talking about a temporary spike here. We are looking at fundamental shifts in global demographics and economics that are just supercharging the demand for everything from disposable syringes all the way up to million-dollar MRI machines.
So here's our roadmap for today. We'll start with industry growth drivers, then look at balancing affordability and pricing, ensuring strict product safety, ethics in healthcare marketing, sustainable design, and finally, securing the supply chain.
All right, jumping right into Section 1, drivers of industry growth, or really, what is fueling the medical equipment sector. We basically have a perfect storm of four distinct socioeconomic factors colliding right now to create this undeniable long-term market boom. First up, we've got an aging global population. That means a rapidly expanding demographic that just requires continuous, technology-assisted medical care. Combine that with the increased prevalence of lifestyle-related diseases, things like diabetes or cardiovascular issues, and the sheer volume of patients requiring medical intervention multiplies. But that's really only half the story. On the economic side, we're seeing immense expansion in emerging markets. As developing nations grow their infrastructure, their citizens are gaining much wider access to health insurance coverage. This unlocks vast, previously untapped populations who can suddenly afford advanced medical care, fueling an industry expansion that is, practically unstoppable at this point.
To actually track this boom, the foundational metric you want to watch is the raw number of units sold, broken down by product category. And the scale here is just staggering. When you're manufacturing millions, or literally billions of units globally, a single defect, magnified across the world, becomes an absolute catastrophe. The immense risks attached to production, pricing, and safety multiply exponentially with every single unit that rolls off the line.
Which brings us to Section 2, balancing affordability and pricing and navigating cost containment.
This right here is a classic financial tug-of-war. To measure how companies handle the downward pricing pressure from government insurance programs and hospital consolidation, you can't just look at one price tag. You have to measure the percentage change in the weighted average list price, so the wholesale acquisition cost, or basically the sticker price, against the weighted average net price, which subtracts things like rebates, discounts, and returns. Tracking both reveals the true ground-level impact of cost containment initiatives. It's essentially the harsh reality gap between what companies want to charge and what they're actually forced to accept just to maintain their market access.
Moving on to Section 3, ensuring strict product safety and the crazy high stakes of mass production.
Look, if you want to know if a medtech company is built to last, you don't just look at their sales sheets. You track these crucial safety metrics to measure their exposure to massive liabilities. The standards require companies to disclose the total number of recalls issued and the exact units affected. They also have to report any products listed in public safety alert databases for adverse events. And, most critically, and quite soberingly, they have to report the number of fatalities associated with their products. Let that sink in for a second. We aren't just talking about a bad quarter or a dip in profits. We are talking about severe reputational damage, heavy legal action, and a very direct threat to human life.
Now, all of that safety actually starts on the factory floor, which is entirely governed by GMP, or Good Manufacturing Practices. When these essential standards are ignored, regulators don't just, send a strongly worded email. They seize products. We're talking about safety inspection non-compliance, warning letters, or even consent decrees that completely halt operations. Tracking the number and type of these enforcement actions gives us a really clear window into a company's operational discipline and their real-world risk.
All right, Section 4, ethics and healthcare marketing, focusing on off-label promotion risks.
Because explosive growth always invites ethical risks. Direct-to-consumer ads and physician outreach can certainly boost market share, but it's an absolute minefield. Companies have to rigorously track and disclose total monetary losses resulting from false marketing claims. If a sales rep goes rogue and pushes a device for an unapproved procedure, what the industry calls off-label use, the resulting fines and legal penalties can literally wipe out shareholder value overnight.
Let's pivot to Section 5, Sustainable Design and Life Cycles, and how they manage environmental impact.
It might actually surprise you to know that the industry tracks the recycling of everything from multi-million-dollar MRI machines right down to disposable scalpels. Companies are being held strictly accountable for their waste. They break the data down into two distinct categories: high-value devices and equipment, and simple, low-cost supplies. By tracking how much of this material is accepted for take-back, reused, recycled, or donated, we can see exactly which companies are successfully navigating the growing pressure to limit their environmental footprint.
Okay, our final stop, Section 6, securing the supply chain and tracing the product lifecycle.
Traceability here is just absolutely crucial. Imagine a defective microchip makes it into a pacemaker. Companies must be able to trace that single chip backward all the way to the raw material and forward to the exact hospital bed. It requires massive, complex technological oversight. They're using barcodes, RFID tagging, an intense chain of custody audits to track products through every single one of these distribution steps just to protect the consumer.
But tracing the supply chain is honestly only half the battle. Securing the actual raw materials is a whole other challenge. These products rely on critical, incredibly hard-to-get materials: rare earth elements, cobalt, platinum group metals. If a geopolitical conflict suddenly chokes off access to these metals, the entire medical device supply chain shudders. To survive this kind of risk, companies have to aggressively diversify their suppliers, stockpile materials, or heavily invest in next-gen recycling technology.
So, how do we keep track of all this? Well, all these metrics are codified in one central place: the SASB standards. It is essentially the ultimate rulebook for investors trying to navigate the chaos of this booming sector. By providing standardized, comparable data across everything from pricing pressures all the way to supply chain audits, it forces total transparency onto this complex paradox of growth versus risk.
Which leaves us with this final, vital question. As the medical device industry rapidly expands, are the companies we all rely on truly balancing their explosive growth with these non-negotiable safety, ethical, and sustainability standards? Because when the products you make hold human lives in the balance, how you manage your supply chain, your marketing ethics, and your safety recalls is what truly defines your long-term success. Thank you for joining me for this explainer, and I hope this gives you a much sharper, clearer lens through which to view the incredible medical device boom.